Hey guys, it's Dr. Moser here. Did you know that November is National Pet Cancer Awareness Month? So a couple little talking points I just wanted to mention about cancer in our animals. I think the first thing and the most important thing is that if we can detect cancer early, we're going to be setting ourselves up for success. So I think that's the most important thing anytime we talk about, honestly, any type of cancer. Specifically when we talk about our senior dogs, kind of two different cancer types we think about a lot are cancer types you see externally, so little lumps or bumps on their body, and then internal cancers, so things maybe on their spleen or their liver, so on internal organs. How do we catch those early? I think the first thing is if you feel any lumps or bumps on your dogs or cats, let's bring them in and let's do what's called a fine needle aspirate, meaning we'll just stick a needle in it, take a little sample, spread that on a slide, we'll look at that under a microscope, and we'll say, hey, can we get a diagnosis from this? There's a lot of different cancer types we can diagnose that way. That's usually our first step. If that's not enough, then we'll say, hey, let's take a little biopsy of it, or let's take it off and let's send it out and let's make sure this is nothing we need to be worried about. So the external cancer types, you can see those at home. So getting really used to feeling your dogs and cats, knowing, hey, is this growing? Is it staying the same? Is it changing from soft to firm? Anything like that. From an internal cancer perspective, I think a couple things are important. Doing routine lab work, and on our senior pets, usually doing that twice a year, I think is really important. Talking about doing some senior imaging. So we can do that at their annual exams where we're doing x-rays of their chest and their abdomen, and even doing a small little ultrasound of their abdomen as well to look at their main organs. I think that's really important when we're talking about early screening. And I think you just also watching them at home. How is their attitude? How's their appetite? How's their mobility? I think those would be all good things for you to look for at home. But at the end of the day, cancer, it stinks in humans and in dogs, but if we can catch it early and start treatment early, we're going to put ourselves in a really good spot.